For today's EMN 5, I'm going to talk about fifth metatarsal fractures, specifically the proximal ones. These represent the most common type of foot fractures overall, and there's three different types that we need to identify. So why do we really care about the fifth metatarsal specifically and proximal ones? Because they have a high incidence of non-union and a lot of delayed healing, so we need to recognize them. So of the proximal fifth fractures, there are three types that we need to identify. We have the avulsion fractures, Jones, and stress fractures. And the reason we have to identify these and separate them is because they have very different management, and it can be easy to mistake them and manage them incorrectly if we're not looking out for it. So let's start off with the avulsion fracture. The first thing in identifying which fracture is which is I want you to identify the articulation of the fourth and fifth metatarsal. That's here in orange, you see right there. And the avulsion fracture is proximal to that fourth and fifth articulation. It's also called the pseudo-jones fracture, but I think that's kind of confusing, so let's just call it the avulsion fracture or tuberosity avulsion fracture. These represent 90% of the fifth metatarsal fractures, so most of them are going to be avulsion fractures. And the mechanism is plantar flexion and then an inversion. And the thought behind this is that the peroneus brevis comes in and attaches right there and basically yanks it off. Although now we're starting to see a little bit of literature that says maybe it's actually the lateral band of the plantar fascia. Either way, that's the mechanism, and that's what you need to look out for. Here's an example of that avulsion fracture right here. You can see that's proximal to the fourth and fifth articulation. And one thing to notice is that it's perpendicular to the shaft of the fifth metatarsal. And the reason that's important is because this can be a little tricky. This is the apophysis. It's a secondary ossification center that's normal, and it starts to be visible on x-rays in girls who are around 9 to 11 and boys between 11 and 14. It's a normal finding, and the thing to differentiate it from the avulsion fracture is that it's more parallel, whereas the avulsion fracture is perpendicular. Second, we have the Jones fracture. This was first described by Jones in 1902 when he was dancing, and he actually hurt his own foot and had this fracture. So there's our fourth, fifth articulation again. So this fracture is within that articulation. Now, there's a lot of different definitions to describe this. I think the easiest is that it's a transverse fracture at the location of the fourth, fifth articulation. There's another that says that it's within 1.5 centimeters of the tuberosity. So that's down here. There's the tuberosity. Jones himself described it as 0.75 centimeters within the base. The base is up here, so you can imagine 0.75. Or you can just say it's at the diaphysis-metaphysis junction, but that's a little hard to identify, so I think fourth, fifth is easiest, at least for me. The mechanism here is plantar flexion and then a lateral force. So think about younger people who are playing soccer and basketball. Maybe they cut and end up getting this injury. Now this one's important because there's a high risk of non-union, and we'll come back to that a little later. Here's an example of that Jones fracture. You can see here's our fourth, fifth articulation, and it's within that transverse fracture across there. And if you measured, it would be within 0.75 of the base or 1.5 centimeters of the tuberosity. The third to talk about is stress fractures. And this is a stress fracture of the proximal shaft or diaphysis, or we can say that it's just distal to the fourth, fifth articulation. Now this is an overuse injury, so ask the patient about if they've been having pain for days or weeks before they're presenting to you. And this also has a high risk of non-union. There's an example, so you see that this is distal to the fourth, fifth articulation right here. It also looks like it's a little bit more of a chronic injury, and it's the proximal part of the shaft. So for exam, to decide whether to get x-rays, make sure you use your Ottawa ankle and foot rules. That's the reason we push on the base of the fifth metatarsal there, is to decide if we need to get an x-ray. So why are we identifying these three types of fractures so close in one little part of the fifth metatarsal? Well, that's because there's different management. These are at high risk of non-union because there's that watershed blood supply area, and it makes it not heal very well. So the ones that are at high risk for non-union are two of them, the stress fracture and the Jones fracture. The treatment is going to be putting them in a post mold and have them non-weight bearing for 6 to 8 weeks. Also, they need to have an orthopedic follow-up. Even with the correct treatment, 20 to 50% still fail to have union and end up needing orthopedic fixation. And for stress fractures, this can take even longer, sometimes even up to 10 to 20 weeks of a post mold and non-weight bearing. So how is that different from our avulsion fracture? For the avulsion fracture, you're going to just do an ortho shoe. It's going to be 4 to 6 weeks. Weight bearing as tolerated. They do need to still follow up with ortho, but it actually heals pretty well. So to review, you have three types of proximal fifth metatarsal fractures that you need to identify. You're going to first identify your fourth, fifth articulation, and then you can identify your avulsion as being proximal to that, Jones is within that, and stress fractures are just distal. The reason this is important is because the difference in management. Avulsion fractures is an ortho shoe with weight bearing is tolerated, but because of high risk of non-union in that watershed area, the stress fractures and Jones fractures have to be in post mold and non-weight bearing. Thanks for joining us on EM in 5.